else shortly, but the Greens health spokesman, Senator Richard Di Natale, joins us now from Canberra. Senator, good morning.
Morning, Michael.
Are you confident this measure won't put extra strain on the public health system?
Oh, absolutely. I think one thing that's become very, very clear is that the huge subsidies that have gone into the private health insurance sector have made very little difference to the public health system. The whole policy incentives to drive people into private health insurance were touted as taking the pressure off the public system, and they really haven't done that. So I'm not concerned about that. My main concern is ensuring that we protect the public health system, protect Medicare, invest in it, understanding that it's a universal scheme that everybody should be entitled to access.
At the same time, you're pushing for a similar universal scheme on dental care, and as we've been hearing from Tanya Plibersek this morning, she seems to be backing away somewhat from what you see clearly as a, if not a deal, but a very good undertaking given by the government after the last election to establish this Medicare-style dental scheme. Do you see the government running away from this?
Oh no, I've been in very productive negotiations with the Health Minister. She's indicated she does believe reform's necessary. The Greens made it part of our agreement with the Labor Party when they formed government. We know that there needs to be a really significant investment in dental care. We're really pleased with the outcome we managed to achieve yesterday, $165 million for public dental care. That's a terrific outcome for the Australian community, but we know more needs to be done. That's a down payment on future action. I'll be talking to the Health Minister and indeed the Treasurer over coming weeks, and we hope to get a much more significant investment. But this is a really good start. It's a good announcement. It shows that in minority government you can achieve good things, and I'm really hopeful that we'll get more done in the coming weeks.
But you can see, given the budgetary constraints at the moment, anything resembling a universal dental scheme is simply unaffordable.
Oh, we've always said that you can't implement a universal scheme in year one. I mean, we don't have the workforce to be able to do that to begin with. There needs to be an investment across a few areas. The Greens' plan for Denticare has always been to phase it in over 5 years, but we need to have the foundations laid this year. We need to have the vision for Denticare, which is our plan to be implemented over 5 years, but if we don't start now, we never will. So we're a wealthy country. We're economically in a position far better than most countries across the world. Now's the time to take it on, and what we need to do is make a start. So I'm hopeful that that's what we'll do. We'll get some movement in the coming budget, lay the foundations, and then work over the coming years to implement it so that everybody can go to the dentist in the same way as they go to the doctor. I mean, it makes no sense at all to treat the mouth separately from the rest of the body. It's a crazy system that we've got in place. There are people who are on waiting lists right around the country, many more people who simply don't go to the dentist because they can't afford it. And for a wealthy country like Australia, we can fix that. And here's the opportunity through the current government and the arrangement that we have with independents and Greens in minority government to get that to happen.
Richard Di Natale in Canberra, thank you for your time this morning.
Great pleasure, Michael.
The top